Good evening, everybody. Thanks for joining us tonight for one of our sacred conversations about an exciting new initiative that Partners in Health and Wholeness is launching, which is our inclusion plans. We have inclusion plans that we are highlighting tonight about two particular topics, mental health and healthy aging. So we are just thrilled that you are, one, interested in doing this important work, but also sharing your evening with us. We're grateful for each of you, so thank you for being here tonight. First and foremost, I want to introduce myself and have Krista introduce herself. I'm Jessica Stokes. I've been here with Partners in Health and Wholeness for close to 7 years this spring, and so I lead our statewide mental health advocacy efforts. And I love working with faith communities, especially about mental health. And so tonight is a topic that I'm just thrilled that we're doing. And I also see how it will help you all immensely. And I'm grateful for that. Krista, do you want to introduce yourself?
Sure. Yeah. Hi, I'm Krista Westervelt. I handle healthy aging here at PHW. Been on the healthy aging side for a little over a year, but came to PHW 2021 for my undergraduate peace practicum and stayed on for healthy aging. I'm very excited to discuss these plans with you, Jeanette.
Awesome. So tonight, what we want to talk about with inclusion plans is first and foremost, we will explain what a PHW inclusion plan is and why it's important and how an inclusion plan will benefit your health ministry. We'll also share specifics about the healthy aging inclusion plan as well as the mental health inclusion plan, which are two separate inclusion plans. And so we will try to make this as understandable as possible and make sure that we are all set up for success, and we will offer examples, ideas, what to consider, and how to start this work. But first and foremost, I do want to center us, and I know that for me it's Tuesday and I feel like it should be Thursday or Friday, so, and I know I'm not alone there, so if you will join me in a moment of centering, and let me switch up. There we go. So please pray with me. God of hope and love, we know that you are always with us. We also know that you are an inclusive God. You care about each person. You care about all of us, no matter who we are or what we're going through, or what we need help with, or mistakes we've made, or things that we wish we could go back and redo, or what medications we're on, or what we live with, what concerns we live with. You don't care about any of that. You care about us as children of God for who we are, which is beloved. And for that, we give thanks. We find rest in that. We find hope in that, and we can also find peace in that, God. And with all of that, I pray to you that each of us be reminded of that truth, that we can seek you for our identity in you, God, that we can find that hope and peace when we feel like there's nothing around us that feels right or feels good. We can ultimately turn to you and attain a peace that's not of this world. And inclusion is a big piece of that. And through you, we can offer that to our neighbors and the people in our community. And through our health ministries, we can bring that hope and peace to the world. So we're grateful, God. We are so thankful for tonight, and we're thankful for each person who is tuning in, whether tonight or later on with the recording. I ask that you bless our work so that we can be about something that is shalom and whole and healing. And for all that, we lift up to you in your name. Amen. Awesome. So let's see here. And I'm going to find a way to do, here we are. This is good. I think you all, that means you can see our faces. But Krista and I, this is supposed to be a engaging conversation. We don't want to take things over here. What we want to do is offer an idea and a way of doing this, what we're calling an inclusion plan, and bring forth some energy we've had around this and see how it lands with you all. Because ultimately, as the people on the ground doing this work, we want feedback, and we want to know what you all need in order to be as inclusive as possible with your health ministries. That's the ultimate goal, especially around mental health and healthy aging. And so, Krista, if it's okay with you, I'll kick us off by reading this loose definition that is flexible and dynamic, and we're probably going to change as we learn more. I'm going to kick us off with reading this, and then please feel free to hop in here. But what is a PHW inclusion plan? What is this? Why are you here tonight? Inclusion plans are intentional, strategic plans that support a health ministry's outreach, programming, relationship building, and overall impact. These plans ensure that all people are welcome and included. Okay, that's a lot. That's a lot. It's audacious, right, Krista?
I mean, these are aspirational. These are not things that you're going to take it and tomorrow we're going to be perfect at it. I mean, right. As we all know, it's a journey. And so we're on this together with you, and this is our way of supporting that. Right. With finding ways to offer some additional benefits that are, I think, on one of these other slides.
Oh yeah, I accidentally hit the wrong.
Yeah, what we got next here?
You want me to go to the next?
Go ahead. Yeah, well, yeah. This will maybe help. So go ahead.
Well, first and foremost, let me actually, I have a couple of thoughts on this. What is a PHW inclusion plan? So the way I have been thinking about these inclusion plans, essentially, I think of them as roadmaps. So what we will show you in an example later on in our presentation is that when we say intentional strategic plans, what we are proposing is that with your health ministry, if you take the time to think about who is missing, when you think about your health ministry, for instance, a food pantry perhaps, or maybe a grief support group, or whatever it may be around in your spaces that make up your faith community, who may find it hard to join in and come and find resources, or even attend worship, or have maybe a hard time just, I'm talking literally getting through the doors. So I think that's a good place to start, because again, the ultimate goal here is that what we want is for all people to feel welcome and included. And we'll get into some of those deeper whys later. But what is in a PHW inclusion plan is essentially a plan to make sure that all people are welcome. And that includes evaluating what we're doing, and if we're doing it in a way that is accessible. So I think that's a good starting point for us, thinking of it as a roadmap. And so as Krista was saying, for the next slide, why is this important? I mean, maybe you have your thing going on at your church or your faith community, your food pantry, for instance, or whatever you have going on, and you may have more people than resources. You may have so many people, but yet what we are working on here at Partners in Health and Wholeness is improvement in a way that is authentic and about shared dignity, radical welcome, and community inclusion. I know some of you have heard me talk about those concepts for years now, and I'll never stop talking about it, because I don't know anybody who does it perfectly, because that's the beautiful part of doing ministry together, is that we're always learning. But Krista, why do you think an inclusion plan is important?
Well, sometimes, I mean, you said it, I think, pretty well already, is that sometimes, some people just haven't even been able to make it into the door. So you don't know until you start sort of creating these more inclusive spaces within your faith community who didn't think that they could get there.
Right.
And so whatever we can do to help, lower that barrier of entry, I think we want to do that. And I think doing this in a collaborative way where we're generating these initial pieces for you to use and to grow. And then as we get feedback from you, from the different faith communities across the state, then we can even grow. You might have seen something that we didn't even notice, or another congregation didn't know. Oh, hey, we were missing out on including people with this particular need, or what have you. And so these are ways that together we can grow the larger network of beloved community within the state and within the various faith communities that we partner with. So
that's right. Yeah. No, that's well said. It's all, again, I'm going to say intentionality a lot tonight, because sometimes we, even with, how do I say this, the way that we want to impact our neighborhoods and our communities for good, even with the best intentions, all the altruism in the world, sometimes we might have some blind spots in our ministries. And that's something we talk a lot about with our mental health work together. I know some of you have done our Becoming a Trauma-Informed Faith Community toolkit. And I know in talking with some of you, that was hard, but interesting conversation that you've had with your deacons or with your Stephen ministers or whoever, pastoral staff, to consider, what could we be doing better? And so inclusion plans are another way to do that hard work. But what we're hoping is that by looking at, difficult things where we may not do things well, perhaps with some of our health ministries, the good news is that this will help alleviate some of that and help us do things more productively and more efficiently. And so I think of inclusion plans as essentially agreements and touchstones for your health ministry, because when you do the hard work of digging in and collaborating together with your team to think, who do we want to make sure knows they are welcome here? And how are we going to do that? Which we'll get into here in a little bit. For instance, with a mental health ministry, how do we want folks who may not even be in the church as a congregant know in the wider community, here at our church, we are working on this. So do we want to make sure we have a place where a NAMI peer support group is hosted here, so people outside the congregation know about us? Or maybe one Saturday we want to host a mental health first aid training and make that open to the public. There's so many ideas that you all have come up with and we share with you, which we'll get into, of being intentionally inclusive. And so thinking outside our normal way of doing things, agreeing to it as a health ministry, and then submitting a plan and going and living it out. It's a way of accountability. And another reason I think this is important to consider is that this work is hard. And with all things, that touchstone piece is grounding. And so you have through an inclusion plan, you have a plan that you can always return to. So maybe you're feeling discouraged because you've been trying as much as you can to get a project going or get more folks from the community involved. And maybe you're not seeing results as quickly as you thought you may or you would. And so instead of the usual maybe feeling burnt out or getting discouraged, you know that your team has this core document that you agreed on and you landed on, and it will help you remember, this is why we're doing this work. It's a deeper why. We're doing this because we believe that God cares about all of these people, including us. And so it is a way to center our work. And so, yeah, Krista, any other things you want to say?
No, I think that's great.
Okay.
I think that's great. Yeah, and it sometimes I think too can help. I mean, you're talking about touch points and whatnot. I think sometimes when folks try to approach health ministry, they think they have to do everything at once, or this sort of takes it and makes it gives you some bite-sized chunks that you can start attacking rather than trying to eat it all at once. So the
Right.
hope here is to, to make this easier in some ways, demystify it and give you room to bring more people even into the planning and the execution of all these different ideas and ways.
Yeah. Yeah, that's well said too. I like that, demystifying it. I think ultimately this inclusion plan is also meant to be empowering. So that's something I hope we can illustrate tonight. So it's empowering. It offers a centering for your health committee, a place to return to when things are hard and you feel discouraged. It also reminds us of the wide welcome that is God's love. So those are good reasons, and that certainly benefits your health ministry. So what are some other reasons, ways that the PHW inclusion plan benefits our health ministries? Krista, do you want to take the lead on this one?
Yeah, so these are just like, certainly we hope that there'll be even more benefits beyond these, but these were just kind of some initial things that we're thinking about. That these would offer some inspiration and fresh ideas for those who are just getting started, those who want to expand, and those who want to see ways of how can we sustain this work. You can start small, you can start as big as you want, you can start midstream, wherever you are. We're trying to meet you where you are so you can meet people where they are. Yeah. And this is going to empower you in that. We're bringing some evidence-based frameworks. We did the heavy lifting on that for you. You're an expert in your faith community, and we're bringing some evidence-based expertise to this so that you can be equipped with that as you go forward. So that's a benefit to you. And then, as we kind of hinted at, I think here is just that it gives you that balance of structure and flexibility. It's not meant to be you must do it exactly like this. Right. It's meant to offer you, here's this skeleton you can build on. And your faith community, the people within your faith community, know what the needs are, and this will help you to do that with the flexibility to engage with what is needed in your faith community in particular. And so I think that those are some sort of initial benefits to it.
Yeah, no, that's well said too. Yeah, there's so many ways that a PHW inclusion plan benefits your health ministry. Ultimately, I think this work is sacred first and foremost, because with the intentions that we want to make sure all people are included and feel welcome. I mean, you can't go wrong with those type of intentions. Does that mean that our health ministries will be perfect and we won't have any issues and we won't get things right? That certainly, no, things were human. But I think with the right outlook from the start that the inclusion plan helps us with, it just, again, it's a very centering process, because all of you who are on the ground, I know you are busy. I talk with you through the week. I know that you get phone calls and you hear from people who are hungry, and you hear from people who need rides to the doctor, and you're trying to help folks pay for their medicines. And you are, especially with the pandemic, I know some of what you hear throughout your week, especially as community mobilizers within your faith community. And ultimately, I think that this will help folks maybe join in with you in what you are doing, if that makes sense. It will empower folks to also maybe roll their sleeves up a little higher, if you will, because a plan helps a visualization of how we're going to go about this. And as you'll see, we're talking about ideas and ways to do inclusive health ministry, but we also ask, well, what resources do you need? What is your plan? How do you know what support from PHW do you need? And we'll get into that here shortly. So I'm going to, I know you have a cool quote here. So Krista, I'll hand it to you, and then I'm going to stop sharing for a brief moment. When you're ready I'll pull up the PDF. So you tell me.
I'll let you know. Yeah, I'll give you the heads up as to when.
Cool. Sounds good.
Yeah. And so, all right. So this quote comes from an excellent book on pastoral care called Injustice in the Care of Souls. And there's a there's a section in it by Janet Ramsey called Senior Adults and a New Story for Pastoral Care, which is excellent. And Janet writes, in congregations where there is intentional ministry with, by, and for older members, there is a richness of intergenerational activity and mentoring that serves everyone well. And so I think the aim here with the Healthy Aging Inclusion Plan is to help you be proactive and engaging across generations in order to create that true sense of community and inclusivity. All right, we go ahead to the next one. All right, so within the inclusion plan, and when you get to see it, it goes a bit more in depth. We're just going to cover kind of the main elements of inclusion. These were adapted, again, as we mentioned, from evidence-based works. And so this comes from a mix, a melding of the International Council on Active Aging, the University of, I cannot pronounce it, in Finland. They made a new active aging scale, which is excellent. Beyond the scope of this work, but I applied it as best I could to a way that could be packaged within your congregation. And the priorities of active aging and Alan Walker's work on active aging. And there's within the inclusion plan itself, it gives you a little bit more background on each of those in a way that it's not overwhelming, but will help you understand where we're coming from in this. So some of those elements that I distilled from those works in terms of the commitments that you can make within your congregation were emotional, a commitment to be supportive of the varied emotional lives and mental health needs of the older adults in your faith community, environmental, a commitment to aid and create inclusive and accessible indoor and outdoor physical spaces for older adults of varied physical abilities within the worshiping space and beyond, intellectual and cognitive, a commitment to being inclusive and supportive of older adults in your faith community and their varied intellectual and cognitive abilities and needs. Next slide. And I'll have examples for these two for you, don't worry. Physical, a commitment to supporting the health and functional ability of the older adults in your faith community through inclusive opportunities for physical health and wellness, as well as offering support for and prevention of chronic and emergent health conditions. And this commitment extends to providing inclusive communities for those with physical disabilities. So again, these are pretty broad, but have different steps that I think are doable. Professional and vocational, which might not be something you might usually think about within the congregational context, but our faith communities do offer this. A commitment to offering older adults opportunities for meaningful engagement within the faith community and beyond. Social, a commitment to offering engaging social experiences for older adults in a variety of settings in order to build and maintain interpersonal connection and prevent social isolation. And these might seem like how's this healthy aging, but they all work together, components of health and well-being. All right, next slide. And then the last two, spiritual, a commitment to supporting inclusive opportunities for spiritual growth and exploration. And that seems like that's, you were like, well, that's sort of the basic thing. We're faith communities. But this is broadening the ways in which we include individuals within these opportunities for spiritual growth and exploration. There's always room to expand in one form or fashion. And then economic, the commitment to economic inclusivity and to the economic well-being of older adults in your faith community through congregational support and referrals to appropriate community agencies and programs. And one thing that you'll find within this plan is an opportunity to connect with other resources beyond your faith community. There's an expectation here that you can be everything to everyone in terms of resources. And so we want to make sure that you know where to look for those programs within your community that can help you respond to these needs for your older adults in your community. All right. So what is in the toolkit? And we'll take a look at it in a moment. To help you address these things, because it might look daunting at first. The inclusion plan includes background details and definitions, examples of inclusive activities and supports for each element. They're not exhaustive, so if there's something in there that you can think of that might fit within those commitments, we encourage you to add it and even let us know. Maybe we can add it to a future version of it. Some of them might not apply to your congregation. That's entirely fine. a planning worksheet to kind of help you look at what are some assets you already have. And I don't mean necessarily money. You might find that some people who haven't had the bandwidth to help with certain things might be excited about parts of this inclusion plan and might be like, you know what, maybe this other ministry wasn't for me, but I am interested in helping with, you know, whatnot. And so it offers you a way of narrowing down, I want to focus on this thing, and what are the steps I can do to get that going and work together with the different voices within my faith community to get this going and to sustain it. And then I have appendices in the back. One of them is on navigating aging resources, which includes a glossary of aging services terms, so you know what to look for, as well as links to the interactive map on our website, which does have resources in every county in North Carolina that will help with a lot of this. And then also, which is sort of new to some of our materials, is a listing of dementia-friendly faith community training resources, which is part of inclusivity. So I think this might be where we could take a peek. I know that's okay. A lot, and I will be around for questions, so don't worry.
I appreciate everybody's patience as I pull up the other. Here we go. All right, back to screen sharing.
Thank you so much for coordinating that part.
Actually, hold on one moment. It's actually, this is a better window to look at it, because
that's the thing, there's like so many places we can take a peek at it.
Yeah.
finding the one.
Okay, can you see my screen right here?
Yeah, we can see it.
Okay.
Just, yeah, kind of cut. Yeah.
There we go.
Yeah. So this is what it will look like. To start, it's got that quote. There's another sort of chart with a model of that we're approaching this in a proactive way. I encourage you to take a look at this. This is a good way of thinking of how we engage older adults within our communities. It's not we're just helping the older adults. We're all in this together. We will live, work, and pray together. So I encourage you to take a peek at that. All right, you can scroll down. This is a little bit more about the purpose of this. I'm not going to read that out to you because we kind of gave you a version of that. And then I defined some terms here for you. What is active aging? What is healthy aging? And so these are some brief explanations of the components that I've included in here as I was creating. What were the commitments that we think that would be helpful for your faith communities to engage with? And if you can scroll up just a little bit so we can see those numbers that Ellen Walker's, or down, I should say, sorry. Yeah, just so I can see all, yeah. And so part of the first two kind of give you an idea of like what some of the elements are. And this part from Ellen Walker is just explaining like the depth of what the examples are that you're going to see. It's about intergenerational work. It's about this participatory and empowering process, which we were kind of getting at earlier, where it's a mix of, ministry leads working on this, but also hearing the voices from the bottom up so that you can partner together and have flexibility. And it's all about meaningful and including people at all stages of older adulthood, whether that's young, old, or those who need assistance for daily living. They are all part of this plan. Okay, you can scroll down there a little bit. So here for each of these, you will see the commitments that I already shared in the slides, and then this will give some examples. So for instance, under emotional, these are some examples of inclusive activities and supports that your congregation might want to give a go. Programming and communications that counter and address ageism, stress reduction and management programs and classes, grief support for various types of grief, not only for the death of friends and loved ones, but perhaps let's say that there is someone who isn't otherwise good health, but they can no longer drive. They might be grieving the loss of independence of driving, right? And so providing these different forms of grief support for different things that might come up in an older adult's life can be very helpful. Caregiver support and respite, including for grandparents raising grandchildren. small group mental health ministry, which will overlap with Jessica's. Opportunities for play, worship, service, and ritual that acknowledges grief and loss, caring ministries, mental health first aid, and of course the awareness of community resources. And you'll see these sorts of things. We're actually going to go through all of these because we'll take the whole so the whole rest of our time. But for each, I try to offer examples. Yes, we plan to get the this out to everyone who attended. Don't worry. Thank you for that question. Then if you just scroll down just a little bit, Jessica, we offered on here underneath each one an opportunity for you to put what are you currently doing that fits this. You know, we want you to not think necessarily from a like, oh, we're not doing enough, but more of a like, here, how can we celebrate what we are doing and look ahead toward what we can do more. And so it goes on. You'll see things around environmental, which is about accessibility, but not just in the church, but can you help people make their homes safer? Are there accessible ways that people can get out into nature? Because that's part of, you know, health and well-being. And then there's intellectual and cognitive for various abilities. And that's some of the options for creating these dementia-friendly congregations and bringing in community resources and referral for that. Physical includes not just you know, getting moving, but also what are we doing for folks with hearing impairments, with visual impairments? How can we make things more accessible? I mean, they have found that people with hearing impairments that don't have assistance with that, they can have cognitive decline because they can't hear. And so the more that we can get people engaged, get them hearing our worship services, our small groups as much as possible, we're helping with this healthy aging. And again, there's a lot for each. Opportunities under professional and vocational. How can older adults mentor and engage in those sorts of ways? How can we do ageism countering programming that push backs on those limits to what older adults are perceived to be able to do? Social opportunities, including, you know, transportation to get to these events. What are some various times of day that we can do events to make sure everyone can be included, especially if people have problems driving at night? And it goes on. And then in terms of like economic, how can we partner with local resources and things to make sure people have what they need? So, and again, we'll send this out. And if we can just scroll down real quick to the worksheet. And so here's the kind of a worksheet that you can work from. You can pick one focus area. And then list a specific goal you want to work toward. We were trying to keep this in bite-sized chunks so that you can do this work and not feel overwhelmed by it. You can look at what assets you already have in the community, what input you need before you get started. Make sure, how are you including older adults in this planning? What steps do you need to take to reach that goal? You can outline those. Who's going to help with those steps? What resource do you need to gather? How much time do you think each one will take? And when do you plan on reaching those? And once it's reached, how will you maintain it? And how will you get feedback before, during, and after? And then I added a spot in there, how will you celebrate and spread the word once the goal is reached? And then an opportunity to commit to sharing what you've learned. So we want to hear from you, what you've learned through the process, what worked, what didn't, what you could need more support with, what other faith communities could use help in. And so we really want this to be a process, a learning process for you, a learning process for us. And then of course, there's the two appendices, the navigating aging resources and the dementia-friendly training resource, which there was one that I'd added a bunch of these before, but last night I found another resource that is predominantly for African-American faith communities that offers services and trainings and additional support there too for our BIPOC congregations. So that's a quick version of it. I want to leave time for Jessica to get to the mental health part, but that's kind of a sneak peek at what we're doing there.
Yeah, that's awesome, Krista. I love that. How do you plan to celebrate? Also share what you learned and so forth. I think we need to celebrate more because this is hard work, as we have said many times, but it's also exciting work. So that's great. I love that. And so let me go back. appreciate everybody's patience as I navigate some different, here we go. Let me screen share again. Let's see here. So where were we? Slideshow. So healthy aging, yeah, that is huge for our work. And as Krista pointed out, healthy aging and mental health certainly overlaps. In fact, a lot our work is very, very closely related, because no matter how old you are, no matter what age you are, mental health is important. And many concerns with as we get older include not only our own mental health, but our loved ones' mental health, from caregiver support to the changes that our bodies and brains experience. And so mental health, community support systems change. And when we retire, there's mental health adjustments there with loneliness, and also what is life-giving with finding community in new ways when you are older and maybe do not have children at home, and grandchildren are even grown, and so forth. So a lot of things. I know at my church, I just appreciate so much the ability to talk about these hard things in the sense of mental health concerns and opening them up, because it is amazing watching someone's face light up when they feel heard or known when a topic like mental health is brought up, and in particular with healthy aging, and that person feels that, wow, I'm not the only one thinking about these things. And so that's another wonderful part about working about these topics that, you know, are just not, how do I say this, sometimes pushed aside, unfortunately, in our world. And mental health, to be intentional and inclusive around those living with mental health concerns, ultimately that experience of seeing someone light up or feel known or feel heard, that happens when we work on mental health, because we know with the data that mental health concerns are very common. I don't have to even show you the numbers. I know everybody here on this call knows that. Before COVID, I know that it was some statistic like 1 in 4 adult Americans will experience a mental health concern in their life. But I would imagine that that is a very conservative number if you think about all that life brings and what we experience simply by being alive, and the beautiful yet hard part of being human. And so when we think about mental health inclusion plans, we think about, well, how can we talk about faith, do church, provide resources, provide communal ministries in a way that is shame-free, trauma-informed, and dignity-driven. And so I know I just said some phrases. Some of you know those phrases, some of you may not. We actually have an awesome toolkit called Becoming a Trauma-Informed Faith Community. And I really suggest that you check it out if you're thinking about developing a mental health inclusion plan, because trauma-informed is a way of essentially doing this very work right here that we're talking about with inclusion plans. Trauma-informed practices are, to sum up a very big concept, to make it a quick blurb, is essentially we understand that trauma is much more common and prevalent than we have historically allowed it to be. Historically, as a society, we have reserved trauma for for certain situations. And when I say that, I'm talking about war and big issues of violence and abuse. And what science has taught us, we have learned that trauma happens every day to millions of people in ways that impact developmental and psychological growth in our children. Maybe you have heard of the phrase ACEs, adverse childhood experiences. or maybe you have, maybe you grew up in a household that had food security issues. That's trauma. And so faith communities, you all know, from Vacation Bible School to the work we do with our communal ministries to worship, we have people who enter our doors every week who have lived experience of trauma. So by being trauma informed and dignity driven, what we can do is acknowledge people's experiences, acknowledge it in a way that's empowering and shame-free. And that's crucial with this work. With developing inclusion plans, we have to get past blockades that we may have or our own personal stigma that we maybe haven't worked through in order to provide ministry and resources that is holistic and actually allows healing and help. When we have stigma, which that's a good word to define. What is stigma? Stigma, I know you may hear that word often, but stigma is any barrier or judgment or thing that keeps you from somebody else because you maybe have a sense of a negative feeling attached to someone's experience. And so with aging, there's stigma. With mental health, there's stigma. And so stigma keeps us from each other, and ultimately it keeps us from God. And that's why it's so crucial for us as people of faith who, again, even with the best intentions in the world, no matter how altruistic we may be, if we have stigma and judgment and barriers between us and others, and that can be racism, that can be classism, that can be all types of things that divide us, keep us from each other, and therefore God, these inclusion plans won't get far. So that's, I hope I'm painting a big picture here that these inclusion plans are sacred, truly sacred, because it requires a deep work and it's motivating and exciting work and ultimately life-giving work. It helps you as the person doing this hard work, but it also helps the person who may be in need to actually get them resources that won't be full of shame or judgment or an agenda or something else that they simply just don't deserve, right? So all that's a foundation I just wanted to offer here with mental health inclusion plans, because we are concerned about people living with mental health concerns first and foremost, and their loved ones. So that includes caregivers, friends, family, and ultimately this is people in our church. In fact, believe it or not, it may even be your pastor, because all of us have at some point dealt with something in our emotional and mental capacities that was hard and difficult. And when we can connect with each other in a genuine way and bridge on that is healing in itself. So let's see here for my next slide. Again, I just want to say it's a lot of work to be done, but the goal is to encourage the health ministry and the overall efforts of the faith community to be intentional. I know I already said it, I'm saying it again, you'll hear that word a ton, and hope-filled around mental health concerns and eliminate stigma around mental health. And so these efforts will provide healthy support that is trauma-informed and non-judgmental. So basically all that stuff I just said, there it is, nice and wrapped up nicely in a paragraph. One quick thing I want to point out that is also exciting is that you see in that first sentence, this is supposed to be encouraging to the health ministry, but what I'm a firm believer in is that with an inclusion plan and this hard intentional work, what will happen is that the health ministry will model this behavior for the larger faith community. And so when you take on the identity and the practice of being trauma informed, and you do that really rich and rewarding but hard work, or maybe you really are going to commit yourself to being anti-racist or whatever it may be that is so sacred and needed, that kind of sacred work, it attracts people. That kind of modeling will help bring healing to a larger faith community. I'm a firm believer in that. So I'm going to show you, I have a different format than Krista because that's a beautiful part of brains. Brains operate differently. And some of you have been with me from the start with Trauma-Informed Faith Community Toolkit. Some of you have heard my joint presentation with Elizabeth on harm reduction and mental health. And so you have seen our huge Google Drive of Google folder of mental health resources. And so we will send you all that. We have all that ready to go and for a follow-up email. But what I thought would be helpful with mental health is to essentially make a Google form, which I'll show you shortly, so that you will have the opportunity to plug in your inclusion plan and you will receive a copy, and then our team will receive a copy, which will be archived. And I want you all to know that for Krista and mental health, for healthy aging and mental health forms, you can go back and update and edit as needed. That is no problem. So even though you hit submit, we can always go back and update a form if your team changes directions or whatever it may be. And no matter what, you'll have a copy so you can then share the plan with your health ministry. So let me pull up this other form here. Let's see here. Google form, and go back to screen share. Here we are. Okay, so I believe everybody can see now. So this is the mental health inclusion plan form. So what this is a template so that you all can brainstorm as a team, but then come here on our website and submit your plan and then get a copy, and we can move forward. But just to briefly go over this, essentially we need to know who you are, your name of your faith community, your health lead. Health lead is a word if you're new here. Health lead is essentially a contact person, a lead for your health ministry. It doesn't have to be one lead or the lead. We just basically need to know who we can reach for questions or so forth. So if you are filling out the form, we would love your email and phone number. And if you are a PHW Collaborative Church, please let us know yes or no. And if you are unsure, that's more than fine. We will reach out to you with more information if you're unsure. And so the mental health plan here is, again, we are working to eliminate stigma. So these are efforts to provide healthy support that is trauma-informed and non-judgmental. So these are some examples of what you can click. This is crucial that I put this sentence here. Please check box next to the statement that you agree to do as a faith community. Please do not feel pressured to check all the boxes. I want to say that again. I would rather you pick one thing and do it really well than feel like you have to click all the things. There's no extra credit with clicking all the things. And again, these are just examples. So you'll have a space at the bottom of the form to fill in gaps or things that you don't see listed. But here are some examples. What a PHW mental health inclusion plan includes. It includes eliminating stigma. We'll do this by the way we speak and write about mental health will be non-shaming and healthier. So we want to eliminate stigma. That's what we want to do. We also want to host speakers and professionals to talk on mental health topics. We also plan to make that accessible to the public. So we want to invite whoever and do a Facebook event so more folks can feel welcomed in our space to hear an awesome therapist or whoever talk about a mental health topic. We want to host a mental health resource fair. We also want to develop a robust referral system and become trained on providing referrals, which, by the way, if you want to do that, reach out to me and I'll put my email in the chat. We can do that. We want to provide space for community groups, such as support groups, so that people know hard topics are welcome. I mentioned NAMI earlier, which is the National Alliance on Mental Illness. Many NAMI peer support groups meet actually at faith communities. Faith communities have invited them to meet in the fellowship hall one night a week, or whatever that may be, or grief support groups, or whatever that may be. Think about how you have the space. Open it up. See what group needs a place to meet. And I guarantee you, if people are looking for, people may not be looking for a church in particular, but if they're looking for a support group and they say that First Baptist Wilmington has NAMI at their church on Tuesday nights, that's a cool thing to know. Just to know that this church is okay with mental health, and in fact they welcome mental health groups and conversations. There's bridge building there, so that's a cool thought to have. I've already mentioned it a couple times, but check out our toolkit. So we will become a trauma-informed faith community. We'll also host webinars and educational opportunities about all types of mental health topics. We also want to encourage and provide mental health trainings to staff and congregants. So a couple of those include, again, mental health first aid, suicide prevention training, all types of trainings, and provide it in a way, maybe there's maybe not a line item in a budget, a church budget, to provide trainings, but what you can do is apply for a Partners in Health and Wholeness mini grant, and therefore you have the money now to go get your people trained. So please know, if there's a will, there's a way there. We would love to talk more about that. Host a book group, podcast, or documentary discussions on those living with mental health concerns. Offer space of leadership and participation to those living with mental health concerns. What do I mean by that? So if there are people who are brave enough to share their story, and they talk about the way that they experience the world or live with mental health concerns, or maybe they have lived through a very difficult experience through a loved one with a mental health concern, or grief around maybe a loss from suicide, for instance. Maybe there's a way to offer a space of sharing if they are inclined to do that, but also a space of leadership and participation to those. That's a big part of community inclusion, which Dr. Mark Salzer, which is a name you'll see in the mental health resource guide that we'll put in the follow-up email. Dr. Mark Salzer is a leading thinker on community inclusion for those living with mental health concerns. And he talks about the empowerment of particular in faith communities, those who have the ability to, like anyone else, have a leadership position, and what that can offer to not only that individual, but the congregation is life-changing. And so there's a lot of wonderful research on that just goes to show the reward and of taking a risk, in the sense of letting folks, not just the pastoral staff lead, but all of us, let all of us lead. That is a wonderful way to pivot from. It also takes things off pastoral staff too, which is always a great idea. And also mental health Sunday worship service, or special service such as Blue Christmas or the Longest Night Advent service, and also normalizing professional therapy and resources, and preventing and treating burnout and other grind culture tendencies to instead model healthier practices. And then you'll see a blank place where you can put more than one thing. You can just you can put as many things as you want under that, and it'll be included. And there's also a paragraph right here. Anything else you would like to add, your group would like to add, would be very welcome there. And so what we also want to know is, wonderful to have these ideas and these hopes that we plan to do, but how do you plan to do it? So what resources? So with your team, to think through, how will we actually accomplish this? Do we plan to apply for a PHW mini grant? Do we plan to call up NAMI and ask for a speaker to come, with someone with lived experience, or so forth? And then how do we plan to attain those resources? Do we plan to, as a committee, as a health ministry team, apply for grants, or have a fundraiser, or do we plan to call up local agencies in our town who provide mental health resources and build a relationship there so that you can invite speakers from there, which I know so many organizations would love nothing more than to get a phone call from a church inviting them to come talk, because that is what they want to be out in the community, trust me. And then last but not least, we want to know how PHW can provide support to your PHW inclusion plan. And that certainly includes me, Jessica Stokes. I'm here for you. We'd love to set up meetings with you all to talk through this inclusion plan. What can it look like for your particular faith community in your county, in your town? I know some folks are here in more rural areas of the state, and that can be tricky. So we would love to talk with you about your particular area in the state and what is in your, assess your resources. And we're just grateful for the chance to work with you. And I know that's a lot, but the summary here is that we're offering 2 inclusion plans. So they're not joint, although they do have so much overlap, as Krista said, but they're 2 separate things. So you're welcome to do both. You're welcome to focus on one and then do one later. You're welcome to just talk with me and Krista, set up a meeting and see what is best for your faith community, to discern that. And I know, again, I just want to say, reiterate that really even taking one of those checking one box is such a great start. And you can always go back and redo the form, edit, update it. So there really is there's no wrong here in the sense. We just applaud each of your intentionality and courage to try this. I mean, we really do. It is just amazing what faith communities can do with the right outlook and intentionality. I just talked a lot. Krista, did I miss anything or anything like that?
I think that's great. Like, I think, the one overlap, I think between both of our, I mean, other than the mental health part, it's just the, like, pick what fits, what serves you now, because you can build on it later, you can shift later. It's not a race. It's all about just what small steps, what little bit bigger steps you can take to become a more inclusive community. So
yeah, well said.
Yeah,
I think our last slide was examples, which we did cover, and just but again, I'm going to put my email here in the chat, and we're close to the 8 o'clock hour, so we have time for just a few questions, but feel free to email us or reach out. We will send a follow-up email with these links, and you will get that. And you will also get this recording, and this recording will be on our YouTube page. And we're happy to connect with you all. Thanks, Chris.
We did have a couple questions in the chat, Jessica and Krista. Sure. So somebody was already asking if they're going to send out like a copy PDF of the worksheet for the Healthy Aging Inclusion Plan. We also have a question about a church that would like to host groups like NAMI. Like, how could they find out about that? How could they find out whether or not there's a mental health organization that's looking for space? So those are the 2 questions we've had so far. And if anybody else has questions, please put them in the chat, or you can unmute yourselves and ask your question as well.
We definitely want to get these in your hands, so don't worry. We want you to have these plans, so we will find a way to get them to you. The follow-up email will have more information in there for you, for sure.
Yeah, no, totally. You will definitely get these. Not only will you get these links through your email, the follow-up email we're talking about, but all of this is actually going to live on our website on its own landing page. So you'll have access to this through email and our website. Thanks, Erica. So as far as the NAMI question, that's great. I'm so glad to hear you're open to hosting groups. That is awesome. So NAMI, which is a friend of ours, a partner of ours, National Alliance on Mental Illness, we are so blessed in North Carolina to have a robust state chapter here, first and foremost. And what they have are called local affiliates. And so if you go to just Google North Carolina, NAMI, NAMI, you will see where you live, a map, you can find the local affiliate. And if you reach out to the head of that, you will be able to find if somebody's trying to start a new group, if they need space. It just really depends on where you live. But North Carolina, we're really grateful to have affiliates almost in most counties. So I know they're growing. They're really growing. So that'd be awesome. Yes, thanks, Vivian. They are. Thanks,
And Alicia put the link in the chat.
Yeah.
Thanks, Alicia.
Yeah, they're wonderful. Is your church open and nonprofits hosting events? Christopher, are you talking about, sorry, your question, is your church open? Are you talking about my church personally or?
Yes, and any of the churches that are involved in this chat currently.
I think so. It just depends on the church. I know, I mean, I work for North Carolina Council of Churches, and many of our churches partner all the time where you are and what you're looking to host. Mm-hmm.
I think we have a couple people who want to ask questions. So I'm going to go with Madeline and then Michelle and then Lindsay.
Okay.
All right. My name is Dr. Madeline Rogers, and I'm the pastor, senior pastor at our church here in Lumberton, North Carolina. And it is by coincidence how God had laid it on my heart to begin having like a hub for mental health that we could get, be able to give out information, have a place that if group sessions need to be held and all of this that you're talking about. So I'm so elated that this is available. So with my email, you have my email. Would I be able to, will you send that information? Or you saying that we could go and get the information from the website?
Yes.
Okay.
Thanks, Dr. Rogers. Yes,
Right.
you will get a follow-up email that will be sent to your email since you registered for tonight that will have these forms and slides and recording and all the information. Yes. And thank you for.
And I am a former member of NAMI.
Oh,
I
cool.
am a former member of NAMI. So I'm gonna go and see what I need to do to get reconnected to NAMI.
Right. Mm-hmm. Yeah, and NAMI's my people. I love NAMI, but there's a lot of awesome groups in our state doing tremendous work. So, yeah, we appreciate all of them.
Hello, I'm Michelle. Remelon Bethel, Amy Zion. I started a ministry last night for aging adults that can't sleep, and it's a midnight book club, and need some help. It was a great night. I did it from 12 midnight to 1, and had a great turnout, and they were so interested. It was just a blessing. Our church is basically adults 70 and older, and they do have problems sleeping at night. And so I need some resources to help to keep them engaged at night and to help them. Definitely, I know it's a mental health issue. Definitely, I know they need, they're lonely. A lot of them are widowers and widowers. A lot of them lost spouses, grieving. And so if you could just help me in that area, I would appreciate it. Because I do it once a month on the fourth Monday from 12 midnight until 1.
That's tremendous. Yes, I will get in touch with you. I love that idea though. I mean, what a blessing to create that space for folks to be connected and not be alone in those hours that they're experiencing insomnia. That's tremendous. Yeah, I will be in touch.
Thank you.
And what church were you with again?
Bethel AME Zion in Spring Lake, North Carolina.
Okay.
Michelle. Thank
Really
you.
great.
Thank you, Michelle.
Mhm.
And I think the other person who had their little hand up was Lindsay.
Yeah.
Yes, I'm still here.
Okay.
Hey, I had a question as it relates to aging. I really appreciate the inclusion aging plan. I'm just wondering if you have any advice about how to navigate competing needs by differing age groups. Specifically, I'm thinking about like in almost every worship setting I've been in, we've encountered trying to navigate between the needs of children and the needs of our older adults in worship. And I can think like specifically right now of thinking about inclusion of children in worship competing with the ability to hear of older adults. And I was just wondering if you had any suggestions for that.
Sure, that might be, might run us a little long. And I'm happy to talk with you separately from here. Some of it is having the older adults partner with the little ones within the worship setting. So if you're creating a multi-generational service and you're partnering an older adult with a child kind of one-to-one to help create that worship service, that could be helpful. If there are aspects of the service for which you can have parts of the service in writing that you might not otherwise already have that in print that they can follow along. Some of that has to do with amplification and sometimes I guess with hearing aids, if kids are kind of rambunctious, it can be hard to hear. So there are some different ways around that, and we can talk a little bit more if you want to connect with me. We can kind of brainstorm that. But I think sometimes just partnering the older adult with the child or groups of older adults and the children working together to help plan aspects of services, if they're multi-generational, I think that could be really helpful. I don't know if that's helpful.
No, it was. Thank you. I really appreciate that.
And I'm happy to connect with you to brainstorm more ideas. I think that's an excellent question, because you want to make it accessible to both. And so this is really about how can we bring these intergenerational partnerships in so people aren't resenting one another. Galen is saying, if the older adults are using hearing aids, getting a loop audio system installed, which brings the microphone audio directly into the hearing aids, can really help. My church got a grant to install
We
one.
have
Yes.
those. Thank you. Yeah, we have those.
Yeah.
Thank you. That's helpful.
But yes, I'm happy to brainstorm some of this stuff with you, and I can put my email back in the chat too if you want to connect with me. But yes, I think a lot of it's just if we pair the young people and the older people to work together, oftentimes that collective ownership, I think, helps to ease some of that tremendously.
Yeah, that's great. And we'll make sure we include our emails in the follow-up email that you get from PHW Info, which is Stephanie, by the way, who you all need to know Stephanie behind that email. She's awesome. I think that with the inclusion plan, so many cool ideas. After we kick this off and you all get the chance to get back with your faith or health community, health ministries, you can brainstorm and think, and then later on in the year, we should have a kind of like a time to gather again and talk about some of the ideas that you all included in your inclusion plans. And because there's been some awesome ideas from you all.
I was already excited, and now I'm more excited, just even from this little bit of feedback we've gotten. Like, I think this is going to be tremendous, and we welcome ongoing conversation around this. We really want everyone to work together, bring these ideas, and I think it's tremendous. One thing I will say, just for clarification, although I don't think anyone's confused on this, these are separate from applying for a mini grant. So if you fill this out, we're not necessarily going to fund. You can apply for a grant for part of these, certainly, but filling this out doesn't mean we're going to necessarily fund it. So these are two separate things, but these can help you in your planning for creating an application for a mini grant. Just want to make that super clear, just in case.
Yes, good point.
And I see Nicole nodding there.
I have a quick announcement, and then Krista, I'll hand it back to you to close us out. And if you have other questions, please feel free to email us. We would love to set up the time to talk with you. I just want to make sure everybody knows that this upcoming Monday, January 30th at 11 a.m., we will have another Sacred Conversation webinar, informational webinar about the PHW BIPOC Mental Health Grant, as well as the mental health hubs So 11 a.m., January 30th, this upcoming Monday, join us on Zoom. These are mental health grants that are reserved for faith communities, predominantly of color, to work on mental health. And we will go over the $5,000 to $10,000 opportunity, as well as what is opening this spring is the mental health hub opportunity. So register on our website and join us. And thank you again for coming tonight. We're so grateful for each of you. I'm gonna pass it back to Krista. So thank you.
Oh, this is wonderful. Thank you so much, everyone. Normally we would do like a moment where we would like take some collective breaths, but I just sort of want to instead just sort of send you off with a blessing. May the Lord of love and wisdom guide your steps as you work together to create the beloved community in your congregations and in your community. Amen.